Okay, Assalamualaikum everyone and good day. We will continue our manual briefing for clinical skill lab. So I'm going to do a briefing today for CSL number 2, which is clinical investigation part 1. We will be talking about vital signs. Okay, so if you refer to your manual, you will find this in module number 2, clinical diagnostics 1, which is vital signs. So let's look at it. Okay. For CSL number 2, most of you are well versed with the vital signs. You know what vital signs are, and you have done it, some of it in your foundation sciences or medical sciences. So in our clinical skill lab, we will be doing more on the clinical practical, okay, on the clinical usage of those theories. All right. So for this matter, in the lab, you will be performing vital signs on your partners, but this briefing will discuss of why and when do we do vital signs for our patients. Okay, so first of all, you need to understand what are the vital signs. Okay, so basically we have four vital signs: blood pressure, temperature, respiration, and pulse. Okay, so there are four vital signs. The fifth one, they say is pain, but it's not objectively measured. So today in this CSL, we'll be concerning of these four vital signs. Okay, so why does dentists need to know about vital signs? Okay, so it's very much related to everyone in healthcare for the vital signs. Okay, it's not just the healthcare personnel need to know vital signs. There are other people who really needs to know vital signs. Okay, so you as a healthcare provider is even more relevant. Okay, so first, vital signs helps the dentist to detect any acute medical emergencies that may require immediate response. Okay, you may prevent the medical emergencies if you can detect unstable vital signs. Secondly, it is part of the monitoring system, which may reveal gradual deleterious trends that can, develop and then be easily reversed before the true emergency occurs. Okay, so if you detect early, you can actually stop from it getting worse, or even can reverse. All right, and the third one, it also part of the monitoring, and you can actually evaluate the efficacy of any emergency treatments or preventive measures that are given to the patients at the time. Okay. All right, so we talk about the vital signs, what types of vital signs, and then I would like to highlight about the important points before measuring the vital signs. First of all, what we need to do, what you need to know from this briefing is anatomical locations and the most suitable for the case. Okay, the most suitable locations for every vital signs. You need to know the apparatus required for every vital sign. Some vital signs do require apparatus, some don't. The third one, know the appropriate technique. Okay, you have learned the technique before. Maybe we can emphasize some of the details of the technique too. Indications for you to obtain these vital signs. This is actually quite important for you to recognize the indications. All right, so we will discuss about this too, and which vital signs need to be measured for your patients in the dental clinic. So that's what we're going to emphasize in this briefing. All right, so let's go to pulse. I'm not going to repeat the whole theory of the vital signs. I'm just going to go over briefly. but I will be talking more on D and E, which is indications for you to obtain these vital signs, and E, which vitals need to be measured. Okay, so you know about the pulse. My take-home message here for pulse and other vital signs is know the numbers. Okay, for adults especially, know the range, know the what is abnormal and what is normal. For pulse, you need to know the location where you take the pulse, and you know the numbers, the rate. For rhythm, strength, and equality, it's not so important compared to rate. Okay, you need to know rate most importantly, but if you know rhythm, strength, and equality, would be better because you can actually diagnose more. You get more information from your patients. Rhythm is talking about the regular and irregular interval between contractions of ventricle. Strength is the volume of blood ejected against the arterial wall, and then the equality, the pulses, okay, on the both sides of the body. All right, and this diagram, please study this diagram. Know exactly where are the locations that you can do or you can take pulse for your patients. These are the techniques. I have also put up, we have also put up some videos for you to learn from YouTube. And these are the numbers. Okay, so please do watch the videos. Um, so let's talk about um, how, when is necessary for you to take pulse. Okay, normally you don't take pulse for every single patient. All right, we don't take vital signs for every single patient to begin with, but there are certain areas or certain conditions, certain situation whereby vital signs are required. Okay, so maybe I will just go over all the vital signs first, and then I'll get back to the indication for each of the vital signs. Okay. All right, so let's move on to the next one, which is blood pressure. So blood pressure is very, very, very important vital signs for you to recognize, for you to know. You need to know the measurement, the numbers, where to take, what is systolic, what is diastolic blood pressure, and you know the technique very well. Please do watch the video if you haven't done any of blood pressure taking. Okay, look at it and try to understand why we do the blood pressure. Okay, one of the prominent name in blood pressure is Korotkov. So you probably have heard of it. Okay, so if you learn about this vital sign, maybe you are aware of this Korotkov. Okay, a person talking about the blood pressure itself. So please do have a look the videos, and then the photo, the image here is showing the manual or the speed manometer for taking the blood pressure. Okay, so in many years ago, we only have this to measure the blood pressure. We don't have the electronic one. Nowadays, we do have electronics one, but still, manually is considered one of the best method and accurate rather than the electronic ones. Okay. Okay, and then this is a stigma manometer part. You can have a look. These are the techniques. Please learn about the techniques. And I have put up the table here taken from Fukuyama and Yagila in 2006. It describes the classification of blood pressure for adults, and then recommendation actions by the dentist. Okay, what happened if the patient is around 135? What do you need to do? Okay, so the recommended action there is actually regular dental care, advise patient of blood pressure status. So just remind the patient about the blood pressure. It's a bit high. Maybe the patient need to watch the progress of the blood pressure. If the blood pressure remain high throughout the day and throughout the week, perhaps, then they probably have to go and see the medical doctors. Okay. So just have a go over study the table and see whether you can make sense of it, right? Um, these are the blood pressure values for adult, children, infants, and neonates. So you can see the difference of the numbers between these age groups. You need to recognize that these age group probably concern for you is only adults. Okay, the children, infants, and neonates. Hardly we do blood pressure when they comes in, but they probably deal with that in the hospital. All right, and please do watch the videos how to for the video demonstration. Okay, all right. Temperature is very hot topic nowadays because of the COVID. Our temperature is being measured whenever we enter any premises outside our home, because temperature can tell quite a bit of a history of ourselves. Okay, so basically, temperature, high temperature, high body temperature, signify uh, infections going on in the body. But then it's not only infection that could affect the temperature. In my lecture, you can probably see the factors that affect the vital signs. Okay, so one of them is actually physical activity that can actually elevate temperature too. So please do read the factors affecting the vital signs, not just for temperature, but for the rest of the vital signs. Okay. Um, and for the temperature, there are different location for you to measure the temperature. Okay, so have a look at this table, the advantages and disadvantages of every site and type of thermometer. This table shows you the normal range of the temperature. Okay, basically it depends on the environment where you take the temperature and what type of temperature, where exactly the temperature is being measured. It's a bit different from these locations. If you look at here, 35.5 to 37.5 degrees Celsius is considered normal range. If you live in a very cold country, probably you are having below 37.5 perhaps, but usually the body regulation maintains the temperature regardless where you are. If you are in a hot situation, the body will regulate the temperature um, by having all the physiological actions in the body. Okay. Oral um, uh, oral measurement for temperature is the most common before this, but nowadays they do a lot of temporal measurement. Or sometimes they do tympanic through the ear. Okay, hardly do by axillary or rectal. Okay, and oops, please do watch the video whenever you are free. Just prepare yourself before coming to the lab whenever we have the session very soon, inshallah. Okay. All right, respiration, hardly done in dental clinic, but you can actually observe the patient for the respiration. So try to understand what does really respiration means. How do you do it? How you can actually tackle people who are having nerve anxiety. They probably having a high respiration rate because of the anxiety. So this could be seen in the dental clinic as well because they are scared, they are anxious. Then they could have uh, fast breathing. Okay, and that would lead to medical emergency too. So in this table, you can see the normal range for adult, which is 12 to 20 breaths per minute. If it is more than 20 breaths per minute, perhaps patient is anxious. Perhaps patient is not having a good, is not having comfortable position there. Patient probably smoker. These are kind of thing that you need to know. Okay, and watch the video for you to do respiration. It's a bit tricky for you to measure respiration. Just put in mind, you cannot measure respiration alone. Will be awkward. So when we come to the lab, we probably will do more of respiration discussion. Okay, and these are the references for the respiration. Doctors normally would look for lung sounds. They also measure the pulse oximetry based on the respiration. Okay, so you can see all the tables there. Okay, so that's about CSL 3 as 2, but now I'm going to discuss about indications. When are you going, the big question here is when are you going to take the measurement? All right, when you're going to do the vital signs. Okay, um, I would say for the most important thing is temperature and blood pressure. Okay, temperature and blood pressure. For blood pressure, uh, let me go to blood pressure. For blood pressure, normally we will take for patient who has history of high blood pressure, patient who has history of heart problem, we will take blood pressure. Usually, patient at the age of 40 years and above, before this they say 60 years and above, but nowadays it is much better if you can take BP for 40 years and above, just to ensure any possible underlying disease or undiagnosed disease. Okay, so because when patient comes to the dental clinic, they are nervous, they probably can trigger high blood pressure as well. So you kind of like screen that bit first before you do. If they are anxious, if they are having high BP, if you do not detect that earlier, the patient might collapse in your dental chair. So you are not preventing the emergency situation there. So if you do blood pressure measurement first, then you know the patient is actually in good condition. Okay, so does every single patient you need to do blood pressure for high blood pressure patients? It's not wrong for you to do for everyone, but the most importantly is for you to do for any dental treatment that involve invasive procedures like surgical procedures, extraction, and anything that involves cutting the tissue, right? Sometimes we also need to consider any types of treatment that can cause anxiety to a patient. For example, scaling. Patient might not be comfortable with scaling because of the vibration. They probably having discomfort at that time. So that's why when we give scaling, it is good idea for you to give local anesthetic so that patient won't feel much of pain, I would say, during the procedures. Okay. All right. So take blood pressure for those age of 40, especially if you want to do invasive procedures. So when are you going to take temperature? Temperature normally you will take if the patient you suspect having infection. So if the patient comes to your office or to your dental clinic complaining of dental abscess or anything that related to infection, perhaps you can take temperature. If you can detect temperature, means that the abscess or the infection intraorally is actually has involved systemically. So what does it mean? Usually when the pressure is raised due to the dental infection, you need to give antibiotics to the patient, okay, because it had already involved systemic. If the dental infection is local, means that you can detect only periapical abscess of a single root tooth, perhaps, and then you measure the temperature. You cannot detect the temperatures raised, means that the temperature is still within the normal limit. Then you know it does not involve systemic yet. So no antibiotic is required unless required. You can just remove the etiology of it, right? Do the root canal, do the pulpectomy, perhaps, to remove the source of infection without giving antibiotic. So I'm talking about the local infection, right? If it is systemic infection, involved in systemic infection, patient will show some signs, especially the raise temperature. Okay, so you take temperature for patient you suspect have infection. Blood pressure for patient who has medical problems such as heart problems and high blood pressure, or any patient who age 40 years above, and plus if you want to do invasive procedures. Okay, so that these are the indications that you might think of when you should take the vital signs. Respiration and pulse, normally if you use the electronic ones, the pulse comes with the blood pressure. Respiration comes with, no, sorry, respiration you have to measure on your own. Um, what's the other one? Pulse, blood pressure, respiration, and temperature. Okay, so that's my briefing for the CSL number 2. Know the indications. Okay, so when we see you in the lab, we will probably do more of the psychomotor part, which is practical of the subject. Okay, so I hope you understand the bits of the what we call this, the story behind the vital signs for dentistry. Okay, if you have questions, just text me anytime. Otherwise, thank you. All the best.